State Representative Matt Muratore, sitting in for Steve Trifoletti. This forum is being brought to you live by PAC TV on Comcast Channel 15 and Verizon Channel 47. You can also watch this on PAC's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthInfo@pactv.org. These forums can be replayed at pactv/Plymouth, pactv.org/Plymouth. Today's participants include Dr. Barry Potvin, the chair of the Board of Health for the Town of Plymouth, and Michael Jackman, the district director for Congressman William Keating. Thanks, guys, for joining us today. And Dr. Potvin, let's start with you. Give us a little bit of an update of what's happening with the town and what's happening with the Board of Health.
Okay. Can everyone see that on the screen?
Nothing on the screen.
Okay, then I have to go back and I've got to do screen share after all, I guess. Should be there now.
Yep, there you go.
Okay. So this is all information I gathered, some of it within the last 30 minutes or so. So just going through them as quickly as I can. This shows you our average daily cases per 100,000 population over 14 days. And you can see way down on the right-hand side of the graph that we're still going up. And the increase in the last week was kind of significant. These are the data for the United States, Massachusetts, and Plymouth for cases and deaths. And you notice that in the US, we've now exceeded 40 million cases. And mortality rate from these cases is about 1.62%. Massachusetts is 765, 584 with a 2.39% mortality rate. And in Plymouth, as of again yesterday, it was 5,749. You notice that we now have 152 deaths. This is a small change. Last time we saw a new death was actually on May 9th. By comparison, the influenza mortality rate is 0.1%. So these are the hospitalizations, but it's in Plymouth County. And you can see the graphs for both new admissions, percent of beds used, and percent of ICU beds used. I did just talk to Kevin Coughlin earlier this morning, and he tells me that they have 9 confirmed cases in the hospital at the moment and 14 suspected cases. And there's 4 confirmed cases in the ICU and 1 suspected. And they now have 2 ICU beds still available. And he also told me that the ages for people coming into the hospital has decreased. It used to be people 60 and up, but now it seems to be people who are actually younger than 50. So things have changed. This is the newest data for, again, this is all the entire state. And the positive news here, if you look way over on the right, you see that the curve seems to be flattening out. We may have hopefully reached a peak, and maybe it'll plateau or go down. This is, again, the daily trends for new cases in Massachusetts. And if you look at the red line, you can see the same sort of trend happening. This, again, is the same sort of data. It's a little clearer. This is the state synopsis. And from this, you can see that the rate of new cases has gone up 16% in Massachusetts since the last week. And the rate of new COVID deaths has unfortunately gone up 40% since the last week. And there's a slight increase, but it's small in the percentage of new confirmed hospital admissions. This is the so-called breakthrough cases. And you notice from this, and this was as of September 4th, they compare the current week to the past week. You can see that it has gone up, but the percentage of cases in fully vaccinated individuals is still just 0.53%. The hospitalizations are still very low at 0.02%, and the deaths is 0.004%. That, of course, means that all the other cases and deaths and hospitalizations are among people who are not fully vaccinated. This is the latest designation of risk for transmission that was put out recently. And you can see that now we're down to 5 counties that are high risk for transmission of COVID-19. They include Bristol, Dukes, Hampton, Plymouth, oops, go back one. And I can't, let me see if I can get this out of the way, and Worcester counties. And then the rest of the state is substantial risk, except for Franklin over here, which is at moderate risk. So things have improved somewhat since the last time we gave an update show. These are the numbers down at the bottom here under Delta for fully vaccinated people. It's 52.4% of the US, meaning of course that there's still around 47% that are not fully vaccinated, 65.6% in Massachusetts, and 61% in Town of Plymouth. Down at the bottom, you see these things that came up because of Provincetown, and this was their designation for cutoffs for advisories versus mandates for mask wearing. You can see in the Town of Plymouth, we're now at 3.46, and in Plymouth County, we're 4.22. Things have gotten better in Provincetown, and they have gone back to just an advisory. But clearly, our numbers are not good enough to do that. This is the CDC's transmission risk criteria. So if you have over a case of 7 days, more than 100 out of 100,000 population of positive cases, then you're considered high transmission risk. You see Plymouth County is 170, way above 100, and the Town of Plymouth is just a little bit higher than that at 188. This is the forecasting that was done most recently, and you can see they're predicting that at least in Massachusetts, the increase in weekly cases is expected to level out. For some reason, they couldn't do that for Plymouth County this past week, so this one is more than a week old, but it shows the same pattern. These are our vaccinations that came out as of last Thursday. And you can see, once again, the ones that are underlined are the ones that are below the state average for their age group. So we're still kind of battling to get people in the 12 to 15 year age group more vaccinated. And that's with the 1 or more doses. Also the 20 to 29 year age group, and the 68 is for the 30 to 49% age group. Of these 3, the worst ones are the 30 to 49 and the 12 to 15. So this is the Massachusetts population for comparison, and you can see that in Massachusetts, it's generally 92, 95, some in the 80s, and then some down in the 70s. But it's clearly, in some cases, higher percentage that are vaccinated than is true here in Town of Plymouth. This shows you that information in a graphic form. So these are the percentage of all individuals who are fully vaccinated by county. And you can see that in Plymouth County, it's 59%, in the Town of Plymouth, it's 61%. Then if you eliminate those that can't get vaccines because they're too young, it becomes 68% in Plymouth County and 69% in the Town of Plymouth. So that was pretty fast, but I'll stop the screen share there and make sure we have plenty of time to answer any questions that may come in.
Dr. Potvin,
Thank you,
Dr. Potvin. Just a quick question for you. As chair of the Board of Health, are you concerned with, the last 10 days we had the Waterfront Festival, we had the Maritime event for the Plymouth 400 and Labor Day. Are you concerned that even though numbers are leveling off, that they may climb up again in the next 2 or 3 weeks?
Well, to ask me if I'm concerned is kind of a moot question, because I'm always concerned. But yes, there were 2 large gatherings. I guess the Waterfront Festival was a very large gathering with tens of thousands of people. A lot of them crowded together and a lot not wearing masks. The good news is it was outdoors, and it's probably about 17 times safer outdoors than it is indoors. I guess the Maritime Festival had fewer people. Now the CDC is giving out warnings that you should be very careful in gatherings that are like that, especially in college football stadiums, where there's an awful lot of people gathered, most of whom are not wearing masks and they're very close together. So yeah, it's my job to be concerned.
Okay, thank you. Thank you for your honesty. Again, if you have questions on today's forum, please email us at plymouthinfo@pactv.org. Now we're going to head over to Mike Jackman, who's the District Director for Congressman Bill Keating. Mike, thanks for joining us today. And what's the update from the federal side?
Yeah, thank you, Matt. Just listening to Dr. Potvin's presentation and looking at those percentages, it makes me think back to last year when we were doing this show every day, and I was on every other week, I think. And we were talking about the census percentages, and we were trying to get those boosted up. And it kind of similar now, and working hard to get those vaccination percentages up. If Dr. Potvin's presentation tells us anything, it's that having been vaccinated is one of the greatest tools we have to prevent hospitalization and to prevent death. As we transition into this new phase of the pandemic, with the Delta variant and perhaps even new variants beyond that, I think it's important to realize that we have to use the tools that we have available to us. And I know there's a lot of questions about the effectiveness of the vaccines and boosters and how effective that's going to be. And we are waiting for the CDC and the FDA to come up with more information on that. And, the fact that J&J was a 1-shot, Moderna and Pfizer 2 shots. So there's still a lot of questions. And of course, for children under 12, when those vaccines are going to be available. But it just goes to show you, if you have the vaccine, that is the greatest defense we have against hospitalization, against severe impact, including death from the virus, and also from lowering your risk of infecting others, especially children who cannot be vaccinated at this time. So I really appreciate Dr. Potvin's presentation. But in terms of federal agencies and actions, beyond waiting for the FDA and the CDC to come up with more information and more guidance on vaccines, and the mask mandate, which is on and off throughout the summer, which I think has been a problem for a lot of folks, a challenge for a lot of folks, a lot of communities in trying to decide how to proceed, because folks were doing pretty well with masks, and then when the vaccine started rolling out, we thought we were ahead of the game. And of course, the CDC took down the mask mandate. So not to get editorial, but I think that was not helpful in terms of, again, encouraging people to use all the tools they have to defend themselves and their families against this disease. But I want to talk a little bit about some of the other programs that are out there. It's been a while since I've been on. Since I've been on, there've been at least one. The American Rescue Plan was passed in March, and that's brought some significant programs and funding to the Commonwealth and to the county and to municipalities to prevent, coronavirus spread and to shore up the economy, keep people who are unable to work, be able to, pay their rent, buy food, provide for their families. So I wanted to mention just a couple programs people may not have heard of. The Shuttered Venue Operators Grant program was a program for movie theaters, performance centers, museums, et cetera, to allow them to get some really revenue replacement based on what they had earned prior to the pandemic. And I'm happy to say that right here in the town of Plymouth, we had organizations receiving $2.5 million worth of shuttered venue operating grant revenue to try to keep, you mentioned the Waterfront Festival, the Maritime Salute. Tourism is a huge source of income and revenue for the town and for a lot of employers in the town. So keeping those venues open and viable was so important through the pandemic, and we were happy to see that some of those resources went to Plymouth organizations. Another grant program that people might have heard of was the Restaurant Revitalization Fund. And here in Plymouth, we had over $750,000 worth of grants. I think it was like over 20 recipients just in Plymouth. So that was great to see. You know, there was $110 million worth of that fund in our district, in the 9th District of Massachusetts, which includes the South Shore, the South Coast, the Cape, and the islands. So again, another way to keep restaurants afloat throughout the pandemic. We've all seen how many restaurants have struggled to stay open, how they've struggled to get workers, and struggled to keep the supply chain running, and been able to survive this pandemic. So that was one way that the government was able to help a pretty good number of restaurants kind of bridge that gap. So one other thing I wanted to mention, a program that unfortunately has ended, was the enhanced unemployment benefits. Passed initially through the CARES Act, and then back in 2020, and then it was extended through the American Rescue Plan, where several unemployment enhancement programs, including what was initially a $600 a week supplement, a stipend, and was reduced to $300 a week. There was some discussion as to whether $600 was too much. In some states, again, it was $600 no matter what state you lived in. So some states were only getting, less than $100 for unemployment. And then the $600 obviously was a huge stipend for those folks. And employers in those states thought that $600 was too much. So under the American Rescue Plan, that was reduced to $300 per week. And the pandemic emergency unemployment compensation, there's all kinds of acronyms here, but that was the program that added additional weeks onto the end of the state-provided unemployment eligibility. Initially, under the CARES Act, 13 additional weeks were added. The American Rescue Plan added on 29 additional weeks. And the one that maybe got the most coverage was the pandemic unemployment assistance that allowed self-employed gig workers, those type of employees, to be eligible for unemployment. So those were all great programs, but unfortunately, as of the week ending September 4th, which was last week, those programs have come to an end. So if you have not applied for weeks if you have applied, I should say, for any of those programs prior to September 4th, or if you still feel you have eligibility for those weeks, you should definitely contact the Massachusetts Department of Unemployment Assistance. I should say that there still is a state unemployment program, and I know that Matt and the rest of the legislature are working on that unemployment trust fund, which is a big issue. But people should still, if they're not able to work, they're not able to go back to work or find a job in their field, they should definitely look into unemployment and some of the career training resources that are available. One other program I just wanted to mention regarding again the CARES Act and the American Rescue Plan is housing assistance. Kudos to the Commonwealth of Massachusetts. They started an eviction diversion initiative before the CARES Act was even passed, back in the fall of 2020. And that has done great things for people in terms of keeping them in their homes and being able to avoid eviction. Again, the federal government, seeing what a great job that Massachusetts and other states were doing, decided to add funds, including in the Consolidated Appropriations Act, which was in December of 2020, so-called CARES 2, that added $437 million for Massachusetts to its emergency rental assistance program, which in Massachusetts was called the Eviction Diversion Initiative. And then under the American Rescue Plan Act, another $331 million was added to that, ERA 2. Emergency rental assistance too. So these programs, the Emergency Rental Assistance Program, RAFT, which is Residential Assistance for Families in Transition, Emergency Rental and Mortgage Assistance. These are all great programs that are available to people, but unfortunately, people are just not taking advantage of them. People who are renting and maybe out of work, again, can't go back to work, maybe don't have childcare because of the pandemic. they just are not availing themselves of these programs. And I should say that the program is available to renters and homeowners, mortgage payers, but also it's available to landlords too. So landlords can apply on behalf of their tenants to try to replace some of the revenue from people who are unable to pay, especially while the eviction moratorium was in place. I know I'm covering a lot, but I want to say one thing about the eviction moratorium. Barry mentioned in his presentation with the map with the red counties, which counties were at substantial risk of transmission. I think it's substantial or high in the two designations. So the current federal eviction moratorium only applies to counties that are at substantial or high risk of transmission. So that was again, a compromise by the administration. They were getting a lot of pushback from landlords across the country that people were being allowed to avoid eviction when there was a low risk of transmission and they didn't have to fear to go back to work. Again, not to editorialize, but it's questionable whether that was the reason people weren't able to pay their rent. But in any event, they came up with this designation or this distinction, if you will, that the eviction moratorium would only apply in those counties at substantial or high risk of transmission. The issue being that, if you're a renter and you're unable to pay the rent, maybe you don't know whether you're in a county that meets this distinction. So I guess long way of saying it's really important that people know about this emergency rental assistance program in the Massachusetts, an eviction diversion initiative. You might qualify. There are different income levels that qualify for the different programs. The best way to find out if you're eligible is to call the local regional administrating agency, the RAA, another acronym for you. But the local RAA in our area is located right in Kingston. It's NeighborWorks Housing Solutions. And you can go to their website, which is nhsmass.org, or you can give them a call at 781-422-4200. So I would urge anyone who's a tenant or a landlord or even someone with a mortgage that they're struggling to pay to contact NeighborWorks and find out whether you're eligible for any of these programs. There's a lot of funding available through these, the CARES Act and the American Rescue Plan that has come to Massachusetts. And we want to see it get to people who haven't not been able to pay their rent or who are landlords who haven't had that income, because a lot of landlords rely on that income to make their rents meet. So it's important that people know about these programs. And I think I'll leave it there in case anyone has any questions. Thank you, Matt.
Great information, Mike. Thanks very much. With regard to the state, Dr. Potvin gave most of this information to you viewers on numbers for the state. Just a couple other items. The positivity rate actually went down from last week. It was 2.61%, is now down. The 7-day average of positive tests is 2.32. And I also thought it was interesting to note that to date, there have been cumulative testing is 26,700,000 cumulative tests that have been done since March of 2020. And with regard to the cases that Dr. Potvin said that are getting COVID-19 are the younger population under 50, but the higher deaths are still those over the age of 60 years old as well. So it's unfortunate that even though that there are so many people over the age of 65 that have received the vaccination, we're still seeing the higher deaths in the older population. So gives you another reason to talk to your primary care physician about should you be getting the vaccination to help prevent from getting it to others. And finally, 9.3 million people have been vaccinated here in the Commonwealth. 4.7 have our first shots. So we're looking to probably in the next 3 to 4 weeks, probably being at probably close to 4.7% of the 4.7 million of the population actually getting vaccinated. So we are still making some strides on that. I want to now go to questions. We did have a question for you, Dr. Potvin, with regard to the Delta variant. Is the Delta variant the current strain in Plymouth, or has any newer variant come into the area?
As far as we know, Matt, there is no significant new variant beyond Delta, but at least for the statistics that are coming out of the CDC, for the state of Massachusetts, the Delta variant is responsible for 96% of the cases. The previous one that was the Alpha variant is now way down. Okay. So virtually all the cases are being caused by Delta, and I'm sure that's true in the town of Plymouth as well.
Great, thank you. Mike, question for you. Is there an easy way to find, for people to find information about these programs that you mentioned that speak another language?
Yeah, that's a really good question. One of the things we are really pushing for is to make sure that the state and all these programs are available in multiple languages. So the RAAs, again, including NeighborWorks, are required to have information available in multiple languages. So if you call, you should be able to access someone who speaks your language, English, Spanish, Portuguese, maybe some other languages as well. And also, excuse me, the state Department of Housing and Community Development has a lot of materials about all these programs on their website in multiple languages. So I'm sorry, I don't have that website off the top of my head, but if you do a Google search for Mass Department of Housing and Community Development or just DHCD, that might be the best way to get to that website.
Great, thank you, Mike. And one last question for you, Mike. The president a few weeks ago talked about the booster may be coming September 20th. I know you touched upon that a little bit. Are you still hearing in Washington that it may be around September 20th for that approval?
Yeah, so there was some coverage over the weekend about the president's, the White House saying that they won't approve any boosters until they get FDA approval. But then they've already made the announcement that September 20th is going to be the date. So there is some uncertainty about that. I would definitely watch the news and talk to your healthcare provider about that as we get closer to the 20th. And my suspicion is we'll get an approval on that because there's already been a lot of study. But it's going to be a timing issue, I think, as we get closer to that date.
Okay, thanks, Mike. Mike, and I'll close. We're ending the program now. Quick closing comment.
Yeah, no, I'm just glad to be back. It's unfortunate that we're still where we are.
Yeah.
I do think it shows our resilience and that we're still working on this. I'm encouraged by some events like the Maritime Salute, which, as Dr. Potvin said, was an outdoor event. It is possible to have some events like that. People are doing what they can to be safe. Venues in Plymouth are requiring vaccines for people to be at indoor events, which I think is appropriate. And I think we all need to be doing what we can to slow this pandemic down and make sure we can, for lack of a better term, ride it out.
Good advice.
So thank you.
Good advice. Thanks, Mike. Dr. Potvin, the last minute. Dr. Potvin, last comment.
Yeah, well, as usual, our way out of this and our way to keep more people from dying and getting severely ill is face masks worn properly and vaccinations. So we have to keep at it. And there'll be a lot more discussed about this afternoon at the Board of Health meeting at 4 p.m.
So tune into the Board of Health meeting today at 4 p.m. to get more information. Thank you both, Dr. Potvin, and Mike, Dr. Jack. I almost called you Dr. Jackman. Mike Jackman from District Director.
My rates are very reasonable.
From Bill Keating's office. Thank you so much both for joining me today. Thank you all for watching at home today. Next week, Steve Trifoletti will be back hosting, along with myself and Dr. Potvin, and our other guests will be Heather Cosby, local CPA who has been on in the past to give us some great information about taxes and information going forward with federal taxes and state taxes. So again, thank you so much for watching today. Thank you to the folks here at PAC TV for another great job on a great show, and we'll see you all next week, next Wednesday at noontime. Thanks again for watching.